tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices. With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman, Radiosurgery Hour. I'm from Radiosurgery New York, where we treat cancer. We try to treat it better, smarter, faster, and respect the patients better than the other guys. So give us a call. We have a caller on the line, so I'd like to take that call. It's John. Good morning, John.
Good morning, Dr. Lederman. It's a pleasure and honor to talk to you.
How are you doing?
Fantastic. I'm recovering better than yesterday. Doc, I was wondering, I was diagnosed. They told me I had a non-spreadable cancer and a spreadable cancer. What is the difference?
Well, actually, all real cancer, by definition, is spreadable. Because what's the definition of cancer? The definition of cancer is that it's growing uncontrollably. It's a foreign agent in your body. Your body grows and repairs and reproduces the organs that you were born with. So if you get cut in your hand, the body heals that cut. Or if you have an infection, you get over the infection and the body takes away that infection. I'm just going to take this call. Just 1 minute. Someone's calling us here. Radiosurgery New York, good morning.
Yes, good morning. I'm calling in for the booklet.
Yeah, you're on the radio. Just call us back during after the show or during the week, and we'll mail you the booklet. We have a booklet and DVD that we'll mail at no charge, okay?
Right. Thank you. Bye.
So, John, when you have a cancer, some cancers have known causes and some cancers have unknown causes. But whatever it is, a cancer, if you don't treat it, is going to grow relentlessly. It may grow slowly, it may grow rapidly, but its goal is to overtake your body and destroy your body. It's going to do everything it can to eat all the nutrients. It doesn't respect the borders, the nerves, the bones, the structures. It's going to keep on growing until it's put to death. And it's either put to death by effective treatment or the patient dies, and then the cancer dies with it. So it's a fight, and it's a big fight to stop that cancer. Now, there are some early cancers, like for bladder cancer. There's some superficial cancers. Superficial cancers in the bladder, if that's what you mean, don't invade the muscle. But if they're not treated, they do invade the muscle, and then they can spread to the lymph nodes, and then they can get out of the lymph nodes, get in the bloodstream, and spread to other organs. So that's what cancers do. And in the bladder, there's basically two usual types. One is non-invasive, and it's usually treated superficially. And then once it invades the muscle, that means it can spread, and that's called an invasive bladder cancer.
Thank you very much, Doctor. You've been very clear.
How are you doing?
I'm doing fine, Doc. Much better than yesterday. I'm recovering well, and I'm ready for my chemo on Monday.
Now, you have a bladder cancer. Why don't you tell the listeners what's going on in your life? Tell them what does radiosurgery mean to you? When you come in, what kind of treatments, and why did you choose us? And tell the listeners.
I'm getting. It's a new life. What I was told, I was urinating blood. I wasn't getting any treatment, and I wasn't diagnosed. And for several months, I was urinating blood where I would stain the porcelain quite frequently. And then finally, I went for a GI series at Bellevue Hospital, and one of the doctors says, go see a urologist. And the urologist did a scraping, and he says, you have cancer. He sent me to a surgeon upstate, and the surgeon wound up telling me, you have cancer in the bladder, pancreas, in the prostate, and I'm taking everything out. And I'm going to give you a urinary bag hanging on the side. You'll never use your penis again. The urinary tube is dead, and I'll give you 5 years. I was quite devastated. I said, no, there's got to be a better answer. I said, we're in 2000. There's got to be a better answer. Finally, a friend of mine...
2014, by the way.
2014. Possibly a friend of mine who was into this radiosurgery says, try this guy. Gave me a card from Dr. Lederman's office, and I called, and I followed up. And Dr. Lederman says, I'll give you 20 years. Let me treat it. And the hopes were good, and the things were good, and I'm under treatment now for about 3 weeks, and it's phenomenal. The treatment is good. I'm functional, and I'm feeling much better. I'm feeling much stronger. The cancer isn't eating. The tumors aren't eating my nutrition. I'm feeling much better, and I think this is the way of the new wave of the future because the old wave goes back to the 1950s. I had an uncle who had cancer, and they chopped him up, and that's what they wanted to do to me in 2014. I think everyone should follow up and look into it, and anyone who has a tumor or a cancer, you have to look into this because this is the new wave. Don't go back to the 1950s. Stay to 2014 with Dr. Lederman.
Can you explain you're getting treatments for the bladder in the radiosurgery frame. Can you explain what happens to you each day? You come in and tell everyone what honestly happens.
I come in. I usually sit down in the waiting room. We have a waiting area. It's a very decorated place. It's non-medical, scary. It's very, very generic and a very, very
generic means not special.
Well, it doesn't look like a medical center. It doesn't look like with the tubes and doctors and all this running around. It has walls that are very conducive, very relaxing. You have a very relaxing sitting area. We sit down, and usually we start conversing with the patients, and we start talking and meeting very interesting people from all over the world. And then Dr. Lederman's assistants would take you in, call you in, and you would disrobe and then get ready for your treatment, and then you are prepared, and then you get ready. You get put on a radio machine, and you are treated.
And tell us what it's like. You've been treated. I haven't. So tell us what it's like, what you feel, and what you're thinking when you're getting your treatment.
Well, you're getting the treatment, and you feel like you're in a new wave, a new age. You lay down on this table, sort of like a gurney, and you're fitted with a special tubular for the back for support. That they have to make sure they hit the area direct. They have to hit that direct area. No area that is not infected. and they hit the tumor, and they line you up. Then a photograph is taken, an X-ray is taken to make sure everything is lined up and everything is concise. And then they wind up radiating you. You get about 45-minute treatment. They hit it on every angle. They hit it on the side. They have this oval up on top of the machine that circulates. You don't have to move. You sit there. You hold your arms up, and then this thing circulates. It comes down on you.
Well, what does it mean? It come down on you? That sounds like dangerous.
Well, no. It's on a spring. And it's sort of the radiation machine that helps them get the cancer out, and it doesn't come all the way down. It comes down partially down. So
does it scare you? Is it scary?
Not at all. It's very.
Does it hurt you?
No, it's no different than a CAT scan. Anybody who had a CAT scan, if anything, is similar to that.
Is it claustrophobic?
Not at all. It's very open. The area is very open. The assistants are very congenial. They help you to ask any questions, anything they can do for you. It's yes, sir, and yes, ma'am, and everybody is very, very polite and very, very, very helpful.
How long is the treatment, George?
The treatment is about 15, 20 minutes, maybe a half hour, 45 minutes. From what they were telling me, it's more or less what type of cancer they're fighting, and that's how long the treatment is.
And what do you feel? So you have the treatment. It takes 10, 15 minutes, and then what happens after the treatment?
Well, after the treatment, you have to go. You get ready, and they give you a next appointment for whenever you have to come.
But how do you feel?
I tell you, I feel a little lethargic, comparatively speaking. But, of course, it's an invasion of the body, and you feel that.
Well, what do you mean invasion? Because it's not
like
cutting. We're not cutting out your prostate and rectum and bladder.
Right. Well, it's a sort of, because you're getting radiation. You're getting something in your body. And it's you don't feel like you feel when you're normal and you're not getting no treatment and there's no you're not involved with any sort of medical procedure. This is a medical procedure, and it helps you. It's a new age medical procedure. It's better than getting cut up and then dying in 4 or 5 years. When
you get out, are you able to go for dinner or go to the movies?
I go out after I leave Dr. Lederman's office. I usually head over to Macy's, which is right across the street, and I go some shopping. There's several other shops in the area that I love to go.
If you had that surgery tearing out your bladder and rectum, you wouldn't be over at Macy's.
No, I'd be upstate somewhere convalescing in a wheelchair, wondering how the trees are growing.
With the tubes.
Yes, and
so after our treatment, you're over at Macy's. What? I won't ask what you're buying. And you go home or you go to dinner, or what do you do then?
I usually, if it's a nice day, I'll walk down Fifth Avenue. I'll head over to Fifth Avenue, and then I'll walk home. I live on 23rd Street. The weather is fine. The stores are fine. The store owners all know me because I'm doing it every day. And I go in, say hello, how you doing? They ask me how I'm doing. They're very interested in the treatment. A lot of them have people in their family that are suffering from this disease, and they all ask me, and I tell them. I usually get some cards from Dr. Lederman's office when I walk down the block, and I hand them. I said, give him a call. He's very amiable. He'll talk to you or your relative about what's going on. This is new age. Don't let him go to any sort of surgeons that are going to cut him up and leave him to die. I says, this is something new that's got hope. And when I spoke to Dr. Lederman's office, and he told me that he's going to give me 20 years instead of 5 years, well, that's a bargain. And life hasn't been that great to me, but I'd rather go on, keep living it, and keep trying.
And tell us about your quality of life, because before you said you wouldn't have any more erections and wouldn't use your penis. So is sexual life and urinary life working for you?
Not really, Doc. I still don't have the
Has it changed because of the treatment, or it wasn't working before you started?
No, it wasn't working before. I'm 70 years old, so I wasn't too active. But this whole thing, it all started with the bleeding of the urine. Prior to that, I wasn't having any sexual activity. But I was told by another clinic that the fact that after I get done with your treatment and the cancer care, which will be next month, they're willing, and they said that they can get me erectile functioning again.
Okay.
I says, we'll see. We'll see. We'll take it 1 month at a time.
And how's the bleeding? Are you still bleeding?
No more. No, there's no bleeding. I'm urinating fine. I'm urinating great. I'm having a good life. I enjoy my dinner. I wind up going to sleep at night. I enjoy everything about life. I get out every morning. I go to the park. I go to Madison Street Park. I enjoy the Shake Shack. I'm talking to people. There are many people. Matter of fact, there's someone who's involved with a big movie star